when they first have their surgery. Hello,
Thank you
for joining me. What are some of the reasons that someone might have to have ostomy surgery?
There can be lots of diseases like Crohn's disease, ulcerative colitis, cancer, diverticular disease. It's mainly the disease of the bowel. It's the large and the small bowel.
Yeah.
And depending on whereabouts in that small bowel or large bowel, where the disease is and what the problem is, then that is why the patient might need a stoma.
So what is a stoma, and can you explain how it is formed?
A stoma is a Greek word for mouth, so it's an opening on the body. So you can have a tracheostomy, that's a stoma, and that's when we input oxygen, so these are the input ones.
Right.
A gastrostomy, which is an input of food into the stomach, so those are the input stomas.
Okay.
And then there are 3 output stomas. So there is the ileostomy, which is made from the small bowel, a colostomy, which is made from the large bowel, and a urostomy, which passes urine. The ileostomy passes a sort of a toothpastey, porridge-like consistency, feces. And a colostomy, dependent on where it is, should pass a form stool.
For someone who's due to have their surgery, and obviously they'll see their stoma nurse,
Yeah.
what's the sort of thing that you will talk to them about prior to their surgery?
When we do what is called a preoperative conversation, so we talk about the stoma. We often do, we like to draw, and if we haven't got a diagram handy, then we will draw the bowel and where the stoma is going to be brought through and how this will function. So we talk about the function of that type of stoma, where the stoma will be. The siting of the stoma is really important because the surgeon can do his surgery and bring out a piece of bowel wherever, and it's not something that they would think about, it's something that we do. For number 1, that you can see where the stoma is so you can care for yourself. Number 2, it's in the right position and it's away from any creases, so we're trying to avoid any problems that might occur with appliances. So we try to avoid creases in your tummy, any bony areas like your hip joints, hip bones, so that we're not, it needs to be on a flat surface. That's the optimum area. We can try and allay some fears that you might have. So giving the information about the diet, that things are not going to change that much, really. You can still go out and have a drink. You can still do whatever if you want to skydive, or you've got any aspirations to be an Olympian, then whatever you want to do, you can do that. And it is a really scary time. And I think it's a privilege as a nurse to be part of that patient's journey, because it really is a private thing to.
How often should someone see their stoma nurse? Should it be quite regularly, or does it depend on how long it's been after surgery? Is there a sort of a set time?
All patients are individual. In our service we offer stoma patients, we see them for quite a long time. We see them preoperatively. We talk to them about stoma formation, functioning, and give them lots of advice on where to get their products, what support groups there are. And I think it's important to let them know that they're not on their own, because it is quite scary, because you've been in a little bubble in hospital, you can call on the stoma nurse, there's nurses on the ward that can help. But when you go home, it's quite scary. So we offer patients a home visit a week after, and then we do offer that you can have a visit on a month. You can come and see us in a month's time, and then 3 months, and then 6 months, and then every year. We are always there if you need us, Monday to Friday, and some services are offering 7-day service now. Give us a ring or just pop up and see us, because we never say no, do we?
What advice would you give to a student nurse who wants to get into stoma care?
I think it's not just a student nurse that wants to go into stoma care. I think stoma care should be part of every nurse that comes into an hospital setting or wherever they want to work. Because at some point in time they're going to meet a patient that's got a stoma.
If you have any questions that you want me to ask Jane, feel free to put them in the comments below, or you can tweet us at Coloplast_UK and use the hashtag